Ready? All right, good afternoon, and I want to thank you all for being here. Right now, so much of our attention, so much of our time is focused on the immediate challenge of COVID-19 and the needs of our overwhelmed hospitals and our healthcare heroes as they work to save lives under incredibly difficult circumstances. That's why today, at an event aimed at saving lives, we are doing it in a way that protects lives, with many fewer people in the rotunda here today than otherwise would have been here. We are not just talking the talk, we are walking the walk about doing everything we can to protect one another during this difficult time. But even as we scramble to help these overwhelmed hospitals, sending in the National Guard, marshaling extra resources with nursing students, bringing in EMS strike teams from FEMA, and taking over their testing, we have to remember that other challenges persist. Challenges that were here before COVID and challenges that we will be dealing with long after and that we must address while this pandemic is occurring. And we are. That is why we are here today, to talk about what is happening and what needs to happen to help more Kentuckians overcome substance use disorders. Unlike COVID, there's no vaccine to protect us from addiction. We're all vulnerable. Money, status, power, physical health, none of these save us or prevent someone from falling into addiction. You can find a family in any walk of life, in any place across Kentucky, and they haven't just been touched, they've been torn. The very fabric of who we are, our communities, have been torn, sometimes even shredded by addiction. Just like it doesn't matter where we live, where we work, where we worship, who we vote for, drugs will come to take the people that we love just the same. We say it about a lot of different things, but substance use disorders, addiction, isn't red or blue. It'll kill us all just the same. And rising to address it means we got to be better, and we got to be more than just red or blue or Democrat or Republican. Some of us have a genetic predisposition to succumbing to this disease, but none of us are safe from it. And all of us have been touched by it in one way or another. Many of us have a personal story of the loved one that we have lost. I've now talked to thousands of parents that have lost a child. And as the dad of two kids that I'd give my life for any minute, any nanosecond, I can't even imagine how much that must hurt. But we've cried together, and I've tried to listen, to make sure that I could not only feel that loss, but it stuck with me at least a little bit too, knowing that there are families out there going through this every single day. I pulled an overdosing man from a car myself and watched him stop breathing, and then seen the miracle that is Narcan or naloxone give that person another chance at life. Unfortunately, COVID has made recovery this last 18 months that much harder. Yes, it was unavoidable. We are dealing with a pandemic. But moving forward, we must do better, and those we care about need us to do better. We have seen since March of 2020 a dramatic increase in our overdoses. In Kentucky, there were at least 2,104 drug-related deaths in a 12-month period ending December 2020. That is a 54% increase over the previous years. That's 2,100 funerals, 2,100 families that are grieving, 2,100 communities, again, that had that very fabric of who we are ripped. Those are people who have lost daughters and sons, parents and loved ones. And you know, no matter what the cause, death still hurts. I stand here as a person who's lost two aunts in mere months, one on Saturday. It is raw, it is difficult, but especially when people are taken before their time, it hurts. Each person, each case is distinct, but there are patterns. This increased overdose rate is largely driven by synthetic opioids such as fentanyl and fentanyl analogs. In many cases, people don't really know what is in the pills they're taking, and that combination of depression and uncertainty can become deadly. And 2020 left so many Kentuckians feeling lost and isolated, worried, even traumatized, laying the emotional groundwork for increased tragedy. I think our jobs, you could say, as public servants, but how about just as responsible adults? People that care about their communities, whose faith and values drive them to do better. It's our job to understand the causes of these tragedies and to work with partners and individuals throughout the state to provide help, hope, a hand, the resources, whatever they need to lead people out of the darkness of substance use and into the light of acceptance, opportunity, and community. You know, we're called to help the lost, the lonely, and the left behind. But to do so means we've got to turn them into folks that are found, right? That are accepted, that are loved, and that are with us in every way in society with bright futures in front of them. It's why, as Attorney General, I filed more lawsuits against these opioid distributors and manufacturers than anybody else in this country. It was the right thing to do. These companies have devastated our community, sending tens of millions of pills into counties with 30, 40, 50,000 people. It's why we oversaw the Rocket Docket program. The whole purpose is to get folks that are sick out of the criminal justice system and into treatment as quickly as possible. It's why we work to steer money to resources and treatment centers. In one of the first pharmaceutical settlements in the country, we provided over $8 million to 15 high-quality substance use disorder treatment centers. And let me tell you, I've had the opportunity now to see what a little bit of seed money can do over time. I watched Hope in the Mountains, a women's treatment center in Prestonsburg on the verge of closing, not only stay open helping people, but get Medicaid eligible and now help more people on a daily basis than they could ever dream about. Good folks out there working hard, sometimes with just a little bit extra. How much more they can do, how many more people they can save. How many more lives are still here because of that? How many families are still more whole? We launched the Kentucky Opioid Disposal Program knowing that so many of these dangerous drugs that cause addiction are sitting in people's medicine cabinets, and knowing that cleaning them out is one simple step we could take to protect our loved ones. And as governor, even during this pandemic, we've worked hard to boost access to care, remove the stigma of seeking care. You know, I travel to different recovery centers, and I try to say to everybody there, it doesn't matter if this is your first try, second try, third try, fourth try, fifth try, or sixth try. As long as you are trying, we are proud of you. And anybody who judges you for trying to get better, that says something about them, not about you. Everybody out there working on recovery, in recovery, has the support of this entire Commonwealth. We are with you. We love you. We support you. And we want to help you to succeed. To win this fight, we need to offer more than just words of encouragement. In February, I announced $4.6 million in grant funding to expand treatment and recovery services, including for mothers and pregnant women. By the end of the year, the Office of Drug Control Policy, which you'll hear from, is expected to hit $69 million awarded over 3 years to recovery and treatment efforts across the Commonwealth. And folks, this is a big change from what we may have been doing 10 years ago. It's the recognition that people are sick, not bad, and that they need a little bit of extra help to get better. I was also happy to sign House Bill 7 into law, which ensures communities are recovery ready with those continuum of services like employment, because a good job coming right out of recovery can mean so much in terms of stability. Transportation, knowing that if you can't get to the meetings, to the appointments, and to that job, you can fall back very easily into hopelessness, and to support groups, because the need for other people around you, encouraging you to do the right things, continues even after that initial treatment. Kentucky has a number of other incredible programs out there as well. One that I really love is the Ksp Angel Initiative. I say this with this being established under my predecessor and his KSP commissioner. That's where our brave state police troopers step up in so many ways to help our people, and this program was one of the most innovative ones. The Angel Initiative is a voluntary program that pairs a community member struggling with substance use disorder with a local officer who can provide help with accessing treatment options. Think about how different an approach that is than where we started. The work to help more Kentuckians achieve recovery is important on so many levels. It serves our faith. Second chances is what we believe in as Christians or in any of our major religions. And one of the tragedies of addiction and overdose, beyond the loss of life, is the loss of human potential. Part of what we have to do, and the Recovery Ready Communities Bill can help make this happen, is make it easier for people not just to get treatment and to enter recovery, but to fully reestablish themselves as members of our society. To be able to fully get back to that life that I know that people dream of, back with their families, back in employment, back making a real difference in their communities. We'll focus on that even more in September, which is National Recovery Month. Substance use disorders not only hurts families and communities, but folks, we've got to address it if we want to reach our potential as a state. We currently have an economy that is on fire, where there is more opportunity in Kentucky right now than any time in my lifetime. What that means is there's going to be more and better second chance employment. That ought to be helpful for those in recovery, but more than that, it says we need those in recovery, not just them needing us. Just since January, we've announced 70 new projects totaling $2.65 billion in new investment and 5,800 new full-time jobs for Kentuckians. Folks, we're going to more than double that by the end of the year. So what that means is where we go as a state. If we live up to the potential that we always dreamed of for our kids and grandkids, it's going to in part be determined by getting people better, getting them into these great jobs. And you know what? They can be a big part, as Kentuckians, of helping us achieve while they also achieve. We cannot let substance use disorder rob either individuals that we love, our communities, or our state of the potential that is in front of them and in front of us. So I want to take a moment to thank Kentucky employers who are making a point of providing opportunities to people in recovery. For just one example, thank you Rob Perez, owner of Deviate Kitchen in Lexington, and Dorman Products in Warsaw and Gallatin County. These are two amazing second chance employers that are truly changing lives, and I hope other employers talk to them. They will hear about the most dedicated individuals, blessed just to show up and come to a job each day, loyal, willing to give it everything they've got, and the type of employee that can drive us into such a bright future here in Kentucky. So I want to thank the Chamber, who I know is going to talk about this. I want to thank everybody out there that's giving second chance employment, and to those that aren't. This is an important part of us getting where we need to go, and we need you on board. Today, we also take time to honor the lives lost due to overdose and addiction, and call all Kentuckians to work together to prevent any future pain and any future suffering. Yesterday, I directed all flags on state office buildings to be flown at half-staff today from sunrise to sunset to honor those we've lost from overdose. So that every parent or every child, every sister, every brother, every cousin, every friend that has lost someone to a drug overdose, when you look at those flags flying in that half-staff, that is an honor. It's an honor we do for those we've lost at war. It's an honor we do when a legislator or a governor passes away. Today, it's for you. And it's for your loss and the loss of that incredible person, but also the promise that we can do more to stop future loss, and we can start doing it today. Many individuals and organizations have advocated for our flags to be lowered today, including Team Sharing, a national organization of parents who've lost a child due to substance use disorder. Your children will never be forgotten. Will never be forgotten. And we will continue to fight for their honor and for a legacy of this not happening to any other family. It is critical that we work together and honor those Kentuckians in recovery. As I mentioned, for me, much of this work originates in my faith. It teaches me that second chances are what we are supposed to be offering every single day, and that we are all our brother and sister's keeper. One of my favorite verses says, "So continue encouraging each other and building each other up, just like you are doing already." So now I want to recognize a few of the many people here in Frankfort and all around the Commonwealth who are already working to build up their fellow Kentuckians, particularly our friends and neighbors struggling with addiction. After we hear from this distinguished and bipartisan group of speakers, I'll be issuing a proclamation recognizing today as Overdose Awareness Day in Kentucky. Our first speaker, and we'll ask our speakers to come up to this podium, we're trying to do the right distancing to protect one another here today, is Kentucky's Attorney General. I know firsthand how important this office's work is in fighting this epidemic, and today we're going to hear more about that work from Attorney General Daniel Cameron. Welcome, General Cameron.
Lieutenant Governor, and other distinguished guests, thank you for the opportunity to visit with you briefly. I want to thank Speaker Osborne and Minority Floor Leader Jenkins for the invitation to be with you and to recognize this somber but important day. International Overdose Awareness Day is observed each year as a way to honor the lives lost to overdoses, to support the family and friends who carry on their legacy. Today is a sorrowful reminder that there's not a person in the Commonwealth whose life has not been affected in some way by the drug epidemic. Van Ingram and the Office of Drug Control Policy's Overdose Fatality Report underscores the gravity of overdose deaths in the Commonwealth. The 2020 report showed a nearly 50% increase in overdose deaths from 2019, representing 1,964 individuals lost to overdoses. Let us reflect on this monumental loss, and let us mourn each life that was cut short. But today is not only a day of remembrance, today is also a call to action. As all of you know, collaboration among local, state, and federal law enforcement, as well as community and civic leaders, is essential to combating the drug crisis. In the Attorney General's office, we are trying to do our part, with the help of many others, to muster every available resource to fight this scourge. Getting drugs off our streets is an important first step. Within the last year, our office has participated in law enforcement efforts to investigate and prosecute those who want to destroy the lives of Kentuckians by bringing drugs into our communities. One of those efforts includes our involvement with the HIDA program. Through the program, Kentucky counties benefit from additional federal resources to combat drug trafficking, as well as a greater degree of coordination among local, state, and federal law enforcement groups. This program is a force multiplier when it comes to drug interdiction efforts in the Commonwealth. Just last year, the Appalachian HIDA Diversion Task Force undertook an investigation focused on a single Kentucky residence from which 8,000 oxycodone tablets were distributed every month. That's 1 month in one home. If that kind of distribution can occur in one residence, imagine the scope of the challenge across all 120 counties. That's why it's good for Kentucky to be an active participant in the HIDA program, and for our law enforcement community to be working so effectively together. Not only are we in the business of getting drugs off our streets, we're also holding accountable those corporations who exacerbated the opioid crisis. A few weeks ago, we announced an historic agreement with McKesson, AmerisourceBergen, Cardinal Health, and Johnson & Johnson for their role in fueling the opioid epidemic here in the Commonwealth. This settlement was hard fought, and as a result, Kentucky stands to receive in excess of $480 million. Before reaching this agreement, it was paramount for us to work with our counties, cities, and the General Assembly, including many of the legislators that are here today, to ensure Kentucky received the full amount possible from this settlement. The result was House Bill 427, sponsored by Representative Danny Bentley and supported by KCO and KLC. Under this new law, the settlement with the drug companies will split evenly between the Commonwealth and local governments. As outlined by House Bill 427, these funds will go directly to the Kentucky's counties and cities who need them most and the projects and programs that can serve them best. House Bill 427 was passed with broad bipartisan support and is a testament to the shared commitment of our state leaders to tackle this drug crisis. We're also involved in litigation to defend Casey's Law. The law allows family members and friends to secure court-ordered drug treatment for a loved one who is struggling with substance use disorder. Ending this crisis requires effective collaboration and a sustained effort on every front. I am grateful for the opportunity to work alongside those of you that are here today and our local, state, and federal law enforcement partners to ensure that every idea, every resource, and partnership is brought to bear in this fight. It's up to us to band together, as the governor spoke eloquently about, to push against this drug crisis. By coming together, we honor the memory of those that we have lost, and I want to thank you for the opportunity, Governor and others, to join you today. May God bless you, and may God bless the Commonwealth of Kentucky. Thank you.
Thank you, General Cameron. Our next speaker has provided outstanding leadership throughout the COVID-19 crisis as the head of the Commonwealth's Cabinet for Health and Family Services. So next is Secretary Eric Freelander.
Thank you, Governor. Thank you for your leadership while you were Attorney General and while Governor. You say we'll get through this and we'll get through this together. It applies to COVID. It applies to addiction. General Cameron, thank you for your leadership as well. Thank you, sir. Families, friends, folks that we have lost. I've lost friends too. It's a heartache, and I'm sorry. I'm sorry for the loss of life. I'm sorry for the loss of potential. And most of all, I'm sorry for the loss of love that we all feel. Addiction is a disease. Addiction is a disease like heart disease. Addiction is a disease that involves many different factors. We talk about biology, brain chemistry, psychology, social factors. All of these have impacts on addiction and substance misuse. We need to remember that. It's not about poor choices. It's about a disease, and we need to treat it that way. So, we have to recognize the humanity of those who were addicted, right? Families and friends, veterans, sons and daughters, shopkeepers, all students, all sorts of folks who are people. And we have to remember that they are human and treat them with that respect. That's why it's essential that we join together. That's why it's essential that all of us here as partners can work together to make a difference. I always like to say if COVID has taught us something, and hopefully it has taught us many things, it has taught us that whatever happens to one of us impacts us all. And we have to remember that. So we talk about health care. We talk about health care as a basic human right. Governor, you speak about that as well. And it is. And access to treatment. We have done a lot during very hard times, during a pandemic. In Medicaid, we've taken off all the prior authorizations. We've changed our delivery model to provide more telehealth. We've worked with schools and communities to provide more services. Our service providers have stepped up with incredible creativity to make sure that we are providing the services when and where we can. Thank you for that creativity. You have a partner in state government to make sure that we are as creative as you are. Thank you. Also, we need to know that the folks who are here, our mobile harm response teams, have done great works. Over 70,000 Narcan kits have been delivered. Thousands of lives have been saved. Thank you for that work. And we need to remember what we can do. What can I do to help? Get one of these kits. Advocate for one of these kits. Make sure they're a part of any basic first aid kit that we have out there. We know that it makes a difference. We know that it saves lives. You'll see a demonstration later. So, we're in Opioid Addiction Month. I want to thank the core community that has helped us get through this. I want to thank the Office of Drug Control Policy, Van. You have done such great works. Thank you. The Kentucky Hospital Association is here today. You all have been such tremendous partners. The health departments, again, with all that you are stretched, and Franklin County Health Department is here today with all the stretching that you all have had to do to be able to continue to make a difference in this fight against the opioid epidemic. Thank you. Our community mental health centers, as well as then our recovery-ready communities and our healing communities. We have come together in our local communities to make a difference. Thank you all for doing that. So let's look forward to Recovery Month. Let's tell those stories of resilience and life. And let's tell those stories of those we lost so that we can continue to make a difference in our community, continue with our commitment to make a difference, because we have made a difference, we are making a difference, and we will make a difference. Governor, thank you.
Thank you, Secretary. Our next speaker helps implement the policies designed to reduce substance abuse and the tragedies that it can cause. Please welcome Van Ingram, Executive Director of the Office of Drug Control Policy.
Thank you, Governor. I appreciate that. And let me say, Governor, thank you for lowering the flags today. That means so much. At a time when we're trying to reduce stigma, to say these folks we lost in 2020 matter. And I think nothing says that any better than lowering our flags, so I thank you for doing that. As has been alluded to, 2020 has been a horrible year for us. A pandemic that caused isolation, that caused people fear and so much, just a feeling of dread. So many of folks return to use. And what happens when you return to use in 2020 and 2021 is fentanyl is everywhere. Fentanyl and fentanyl analogs are all throughout our drug supply. Things that look like a Xanax bar are really fentanyl. Things that look like a Percocet 30 are really fentanyl. Things that a purchaser thinks is methamphetamine also contains fentanyl. So it's so important that we do everything we can to reduce those barriers to success in recovery. And I want to thank the Governor and the General Assembly because they gave us tools. They've given us money to do that. They've helped us pass laws when we needed to do that. You know, I talk to other states all the time and they say, how did you get this done and how do you get that done? And I said, I've had the pleasure of working for 4 governors who get this. I've had the pleasure of working with scores of legislators that understand this and understand the need that our people are hurting and there are things we have to do. So with our state aid and our federal aid, what we call CORE, our Kentucky Opioid Response Effort, it's in the Division of Behavioral Health and Secretary Freelander's cabinet. We coordinate every week to make sure the dollars that we're spending complement each other and aren't in competition with each other, that we're all rowing in the same direction. And Secretary Freelander and Commissioner Morris has put a tremendous team over there together at CORE that's doing amazing work. So we're working to reduce those barriers like I mentioned. Well, what are those? Well, transportation is a huge barrier in this state for folks in recovery. Getting to a treatment appointment for us might be a very simple thing of getting in the car and going, but for everybody doesn't have that luxury. Everybody can't, if you're in Owsley County, you can't catch a bus to get to treatment. So we've worked with our Medicaid transportation providers to work out a system where our probation and parolees, our folks that are criminal justice involved, can get a ride to a treatment appointment, can get a ride to a job interview. And we're going to continue to work on these transportation barriers. Safe and sober housing is a problem for so many of our folks. They're coming out of a residential program. The last thing they need to do is go back to the environment they were just in. They need a place, a transition, to get their feet under them. So we've worked with the Oxford House model, and we've worked with other models to try to support good quality, safe and sober housing, and we're going to continue to do that. But none of the work, and the governor alluded to this, is more important than the work we've done around employment. We've been proud to partner with the Kentucky Chamber Foundation to train employers across the state. We've trained over 4,000 business leaders as to why they should do second chance and third chance and fourth chance hiring to be a fair chance employer. And we're so proud to have Dorman Industries and Rob Perez here, but there's a lot more out there. There's a lot of interest. I don't think the Chamber's had anybody close the door on them and say, no, I'm not interested. So we're happy to partner with them. We've partnered with the East Kentucky Concentrated Employment Program, Ksp. And in every one of our career centers around the state, we have a person that's dedicated to helping people in recovery find work, find transformational employment. We've taken 10 probation and parole officers. We've sent them off for training to become job placement specialists. They've placed hundreds of people on probation and parole in meaningful work. We know that we can get people in meaningful work, the transportation and the housing will take care of itself once we get that taken care of. Lastly, let me say this. If you or a loved one is suffering with addiction, there are tools to help you. FindHelpNowKY.org is a tremendous website. 3 or 4 clicks of a mouse and you can find the outpatient, the residential, the medication, whatever treatment it is you need, you can find that. Where you used to have to sit on the phone and call 30 places to find one bed, now you can do that with a few clicks of a mouse. That's operated by the Kentucky Research Prevention Center at UK, and they do a tremendous job. 8338-KY-HELP. That's our statewide call center run by Operation Unite in Prestonsburg. We've just expanded our hours to be open to 10 every night, to be open on the weekends. They field thousands of calls every month from people that are hurting, people who don't know where to go. And we've got trained social workers on the other end of that line that can help guide folks through the bureaucracy of substance abuse treatment, because it can be a little bureaucratic. Or you can go to a state police post, as the governor mentioned, and just say, I need help. I'm addicted to drugs and I need help. And you're going to get help. And this banner over here, state police put that together for us. And it's signed by a lot of folks who have lost a loved one. And if any of you out there are interested, stop by headquarters on Versailles Road here in Frankfort, Kentucky, and that'll be on display, and they'll make arrangements to let you sign that. As has been mentioned, September is Recovery Month. There are thousands of Kentuckians that have really gone to the gates of Hades and back, and they're living meaningful lives, and they're living wonderful lives in recovery. That's the story we want to tell in September. There is hope, there is help. People do get better. Thank you, Governor.
Thank you, Van. Our next speaker has made fighting substance use disorder a priority of hers in Frankfort. This ceremony was her idea, and it was a great one. So thank you. From District 20 in Bowling Green, I'd like to welcome Representative Patty Mentor.
Thank you so much, Governor Beshear. It is my honor to stand with you today, with Leader Jenkins, with my General Assembly colleagues who are here today, and so many families and supporters who are with us virtually on Overdose Awareness Day. Addiction, overdose, and in particular this devastating opioid epidemic have impacted us all, with so many losing a loved one to this disease, and everyone suffering from the human and economic costs that are simply incalculable. I'm deeply honored today to share the story of my constituents in Bowling Green who unfortunately have a very personal connection to this tragedy, and I deeply appreciate the support of Governor Beshear, General Cameron, Leader Jenkins, my colleagues, advocates, and so many others as we pledge on this day of remembrance to do whatever it takes to save more lives. Today I stand here in remembrance of Bradley and Chris Bowling, whose parents, Michelle and Mark Bowling, are with us virtually today. Bradley was my student at Western Kentucky University. He took my American legal history classes to prepare for law school, and his dream was to become a lawyer. I remember so well our talks in my office after class about how to make that dream come true. He was sweet and inquisitive, fun to have in class and lovely to talk with afterwards. He spent lots of his free time playing tennis, and it was only later that I found out what a great player he was. We had begun the conversation about the application process, and he was nervous and excited to begin on that journey. It was on a class day when I expected to see his beautiful face sitting in front of me that I found out he had died. And I felt a shock that remains with me today, that such a lovely person was no longer on this earth. And I wished I could have done something, anything, to have prevented this. Although I did not have the pleasure to know his brother Chris, who was devastated by his brother's death, I'm so grateful I've gotten to know Chris through so many conversations with his mother, Michelle. Both Bradley and Michelle lettered in tennis. They loved sports. They loved their family, their friends. They loved school. Chris also swam competitively. He loved golf, and he really loved his dog, beautiful Bonnie, who is now cared for by Michelle and Mark. Chris struggled with addiction, and he was in treatment more than once. Michelle told me how hard he worked in treatment to fight this, but he was up against a very strong disease. Michelle and I have talked so much about barriers to treatment and how many others who struggle with addiction don't have access to the inpatient treatment programs like Chris did. That is something we must work to change, and we must work to improve access to extended care options. And together we must work to end the stigma and shame that make it so much harder to recover in the fight against addiction. And we must work to build a community of care that is such an important part of recovery. Michelle said something so powerful to me. She said, his disease did not define who my child was. And we must lift up that message at every opportunity. Bradley and Chris Bowling were beloved sons, grandsons, nephews, friends, and they were beloved children of God. Today, I'm honored to remember them, and in remembrance of these two brothers and all of the Kentuckians we have lost to addiction and overdose, I promise to do whatever it takes to save more lives. Thank you, Governor.
Thank you, Representative Mentor, and to Michelle and Mark. These flags are flying at half-staff for your kids and your family today, just like so many others. As I said, substance use disorder and overdoses affect all of us, and to make progress in this fight, we all have to work together. That's why I'm happy to welcome Representative Kim Moser of District 64, which includes part of Campbell and Kenton counties. Representative Moser's done outstanding work on this issue in every session since she joined us here in Frankfort. She filed a 2019 bill that helped save lives by lifting outdated restrictions on the use of naloxone during an overdose. Representative Moser.
Thank you so much, Governor Beshear, and thank you all for being here today. I really appreciate the opportunity to be here before you, and I appreciate the opportunity to have a chance to make a real difference for the families and those who we have lost. And you know, this is a very somber occasion today. Certainly we are remembering all of these family members who we have lost to addiction and to overdose. I believe that we are all touched by this horrible and devastating scourge. I stand here before you today in honor of my nephew, Justin Volpe, who we lost about 1.5 years ago. So it is not something that doesn't touch us all. And I appreciate your story, Representative Minter, because it really personalizes everything that we have been dealing with and all that we work for. It's a good reminder that we need to continue this work, and there's much to be done. As was previously mentioned, and is very well documented, we have lost far too many Kentuckians to this disease. The effects of addiction continue to devastate our families across our state, our communities, and our nation. There is good news, though. Kentucky has made headway on many initiatives. We have more resources available for families. We've had a really hard year in providing access, but last year we lifted some of the regulations in and around telehealth, making it easier for individuals to get the help that they need when they need it. Every state has reported a spike or an increase in overdose deaths during the pandemic, and that one prevailing theme, as Van mentioned, is that we are dealing with illicit fentanyl analogs, methamphetamines, cocaine, and often in combination. And so it's very important that we support our law enforcement initiatives, our law enforcement who are keeping our streets safe, and our interdiction initiatives. HIDA, I worked with Attorney General Cameron. Before I was in this role, I was the Office of Drug Control Policy Director in Northern Kentucky over eight counties, and we worked really hard to bring HIDA and many of those, an Angel Initiative program and so forth, to Northern Kentucky. I'm very excited to see that these initiatives are spreading across the state. They really are making a difference in the lives of so many Kentuckians. So we must continue to expand access to evidence-based treatment and find ways to really reduce those barriers and reduce stigma. I think that we've made a lot of headway on changing attitudes. We in the legislature talk a great deal about mental health issues and addiction issues and how they really co-occur oftentimes. And we've put things in place to lift barriers. We've lifted prior authorization requirements to access medication for addiction treatment. We, as I mentioned, we have worked on telehealth. We have worked with our insurance companies to provide parity for mental health conditions on par with any other health condition. And that was passed last year, the Mental Health Parity Act. Another initiative that I'm really proud of, and I was very happy to partner with the governor's office and so many across the state, the chamber, on House Bill 497, certification of employability, to really make those connections for reentry and to really assist individuals as they reenter their families, as parents, and into the workforce, and really making sure that we support them so that their lives have meaning and they don't continue to cycle in and out of the criminal justice system. There's just so much that we can talk about. We've all been to all-day seminars, and I don't want to turn this into one. So certainly, I would just say thank you very much for all that you're doing. It's wonderful to have such great partnerships on a state, national, and local level, and there are just too many people to thank, really, for making a difference, but we cannot forget those that we've lost, and certainly that's what today is, that's what this month is. But I do look forward to Recovery Month, and we're going to keep working hard on initiatives that really make a difference in the lives of so many people. So, thank you.
All right, thank you to Representative Moser. Our next speaker shows the incredible power of second chance at life through recovery. Beth Davison is Senior Vice President of the Kentucky Chamber of Commerce Foundation. Thank you, Beth, for sharing your story with us here today. Welcome.
Thank you, Governor. Thank you so much for having us. As the Governor said, my name is Beth Davison, and I am a Senior Vice President with the Kentucky Chamber of Commerce, and I'm also in my 7th year of recovery from alcoholism. Thank you. You see, I was destined to have this disease. It runs in every single limb of my family tree. When I was in the 1st grade, my mother had a moment of clarity where she checked herself into rehab. And after, her and my father would enter recovery together. But a few short months later, my grandmother, my beloved grandmother, would end her own life using prescription pills that she used every single day. And 5 short years later, I would start drinking at the age of 12 and enter decades-long passive destruction. And I grew up a white kid with privilege in suburban Middletown, Kentucky, in Louisville, with access to family, resources, and an example of how to recover. But as we know, not everyone is so lucky. As Kentuckians and as survivors of a disease that can impact anyone, regardless of their race, their income, their age, it's our job to fight for those that lost this battle and those that will enter it. And that's why I'm here today. Kentucky has long been known as one of the states that's been hardest hit by addiction. But we're also becoming a state that's a model for innovative and collaborative solutions. And other states are starting to turn to Kentucky for hope. I'm very inspired by the work that's been done to address this epidemic. This is an issue where people from across the aisle, organizations, sectors, are working together to make a positive impact. I look at things like the grassroots efforts of the Recovery Consortium of Kentucky Recon, something that came to fruition because recovery leaders in our states recognized that it's important to advocate alongside of one another. I'm also so proud of the Kentucky Chamber Foundation's partnership with the Office of Drug Control Policy, the Criminal Justice Cabinet, CORE, the Cabinet for Health and Family Services, and the work we're doing to empower businesses to play an active role in addressing addiction. Together, working with Kentucky Chamber members, we've been able to recruit 19,000 fair chance jobs for individuals coming out of incarceration or treatment, because we know that job and purpose matters to the picture of recovery and for long-term recovery. We've also trained, as Van said, thousands of employers on how they can help their employees who are struggling with substance use. And this year, we're going to bring the recently passed Recovery Through Employment Act to life, so that when applicants or employees that fail a drug screen, employers will then be able to refer them on to treatment over just firing them or simply turning them away. I also can't wait to see, and it's been mentioned, the Recovery Ready Communities legislation and how that will level the playing field when it comes to access to treatment, to the social determinants of health, recovery, housing, and the much-needed wraparound services in all of Kentucky's 120 counties. But legislation that addresses addiction and encourages recovery is only effective if it's backed by aggressive and attentive implementation. As we work through implementation, I recommend that all of us as stakeholders watch closely for what's working and what's not. Ongoing evaluation of these critical programs is very critical to the success, and it will be the difference that will help us save lives and make a lasting impact. UC Kentucky, we can't stop. We're making progress, but we still have so far to go. The odds are very likely that another 12-year-old in our state will start using today. And they may not be as lucky as I was. We must destigmatize this disease. I'm now proud to say I'm in recovery, but there were years that went on that I thought speaking up would ruin my career. But now being in recovery is something I'm most proud of. And no one should have to suffer alone, and no one should have to die alone. So today on Overdose Awareness Day, and every day, please join me in remembering the Kentuckians who've lost their lives to addiction. These are our friends, they're our family members, they're our colleagues, they're our neighbors, they're our parents, they're our sons and our daughters. And I'm never going to stop fighting for them. And please know the Kentucky Chamber and the Kentucky business community shares in this same sentiment. Thank you so much, Governor.
So finally today, we're going to have a little demonstration, maybe to help just one or two people that are out there understand how to use what can be an absolute life-saving tool. So I mentioned a little bit about my experience in seeing this work. It was about 4 years ago. I think the last year and a half has been like dog years to me. It was about 4 years ago, and we're sitting in downtown Lexington traffic over in High Street, I think right in front of the Opera House, if you know Lexington. And we saw a plume of smoke come up, pulled the car up, and an individual who was driving, thank God it was in park for some reason, we still don't know today, had just overdosed. And he'd stopped breathing. It's a large man, and so Josh, who I was with, he was making sure I was safe as AG, and I started pulling and pulling and pulling him, knowing that whether or not we got him out might make a big difference in how well this, if we'd have had it, would work. And we got him down finally to the pavement. I remember gravity took over, and I kicked my foot under his head, as it otherwise would have hit. And then I watched him stop breathing. I mean, I watched those colors that people change as they die. And that's exactly what was happening. He didn't breathe for minutes. And he was gone. Thankfully, Lexington police pulled up, had this within their car. Josh, who is an EMT, was able to administer it. EMS showed up. It took multiple doses because we think likely this was a fentanyl overdose. He started breathing again. I've never seen somebody come back from the dead, but that's exactly what happened that day. 2 weeks later, I made sure that every investigator in our office not only had this, had to carry it with them, but got trained on it, and I sat in on that training. I'm telling you, it wasn't 5 days later that one of our investigators made a save at a McDonald's drive-thru in Carter County. It was 11:58 in the morning. But for this, that individual that I watched stop breathing, that individual in that McDonald's drive-thru would no longer be with us. So we're going to take a minute to make sure if this is the only thing that some people may see that are watching, that there is at least a little bit of training about how important and critical this is. So today, we mourn those that we have lost, but we're going to do at least one thing to try to make sure that we don't lose others. So I'm going to have Eric Freelander come back up and our partners with the Kentucky Pharmacists Association to share a moment about this. And after that, we're going to sign this proclamation and make sure we honor every single person that's no longer with us, and we recommit to doing everything we can to make sure we don't lose any others. Eric? I'm sorry, Secretary Freelander.
Does feel like a long time. So, thank you, Governor. Narcan saves lives. If there is one thing you pay attention to, please pay attention to this next demonstration. So, right now, I'm happy to introduce Dr. Jody Jaggers, Director of the Pharmacy Public Health Programs at the Kentucky Pharmacists Association, for a short demonstration. Thank you. You can make a difference, and you can save a life. Just watch.
Thank you so much. I want to reiterate something that Governor Beshear and Secretary Freelander said, that a lot of you at home today are probably wondering, what do we do? How can I help? Because a lot of these things we've talked about are very specific programs, and there's one thing that is very easy to do, and that is to learn how to use naloxone and to carry it with you. And anybody can do that. Being a first responder is not limited to being an EMT or a paramedic or a police officer. Every one of us can be first responders in this state. And so I just want to take a moment to show you how easy it is to use Narcan, and just to hopefully maybe make it easier for you to approach your pharmacist or somebody else, your doctor, about getting access to this and carrying it with you. So naloxone, Narcan, only works in overdoses for opioids, but it's safe, it's effective. You can't overdose somebody with this. It's not a controlled substance. It's not something that somebody can abuse. And so there's really no way to mess this up. If you think that somebody has overdosed, you're looking for someone that's unresponsive, that's not breathing. You want to try to rouse them, shake them, say their name if you know it, make knuckles, press on their breastbone really hard. That's a sternal rub. If they don't respond, the next thing you need to do is call 911. Tell the dispatcher you have somebody that's unresponsive. Tell them you think it's an overdose. While you're waiting for EMS to show up, you're going to get your Narcan out. This is what a box of Narcan looks like. If you get Narcan and you ever forget any of the steps, you can open up the front of the box and it shows you right inside the box how to use it. But when you open up the Narcan, each Narcan box has 2 trays just like this. Each tray has 4 milligrams of Narcan in it. You peel the foil back on that tray, and this is your dosing device. And it's for left or right-handed people, it's going to work just the same. You're going to hold it just like this. You're going to gently insert it in the person's nostril and press that plunger in, and that is 1 dose. You step back and you just wait. This is the hard part. You need to give it a couple minutes. It takes 2 to 3 minutes or more in some cases to work. That feels like an eternity when you're responding to somebody that's not breathing. Give it a couple minutes. If you don't see signs of life, get your other dose out, repeat those same steps, put it in the opposite nostril, press the plunger in. One thing that I want you to remember if you ever use Narcan, you don't push this plunger in unless it's in their nostril. This is not a product that you have to prime like you may be used to with other nose sprays. Once you push that plunger, that dose is going to come out. And so if it's not in their nostril, it's not going to help them at all. Step back and watch. And again, if you don't see signs of life, at that point, you can continue that process as long as you have naloxone. So if you have friends that have multiple boxes, you can keep giving it to a person. They're not going to overdose from the Narcan. When they do come to, you need to be prepared for them to maybe be agitated. You're going to put that person into withdrawal. For somebody that uses drugs regularly, when you block the effects of that drug in their body, it's not a very pleasant experience for them. Understand that that is not harming the person. It's temporary, but they're going to be very unhappy. So just give yourself some space to be able to talk to them, tell them what's going on. Keep doing this. Stay with them until EMS arrives. And then just as far as storage is concerned, naloxone is very easy to store. All you have to do is just keep it more or less at room temperature, but the most important thing is keeping it with you so that it's usable. So whether it's in your vehicle, whether it's in a purse or a backpack, whatever it needs to be, keep it with you, keep it on your person. But carry Narcan. If you're a business, put this in your first aid kit, keep it with an AED. If you're an individual, keep it with you. Thank you.
And it's good to see you again. We were at Governor Scholars together a while ago. Thank you for helping today. So again, today we mourn those we have lost and we lift up their loved ones. We also celebrate the work that so many Kentuckians are doing to make sure that our friends, our children, even our parents are safe. Before I sign the proclamation, I want to acknowledge some other partners that have been mentioned. Justice and Public Safety Cabinet Secretary Carrie Harvey, Operation Unite, the Kentucky Injury Prevention and Research Center, Dr. Sharon Walsh, Director of the Center on Drug and Alcohol Research at the University of Kentucky, Kentucky State Police Commissioner Philip Burnett Jr., and Danielle Perkins, Executive Director of the Kentucky State Police Angel Initiative. So at this point, we'll sign the proclamation, but if we can, I want to do this in two parts. You know, normally we just have our elected officials come up. We'll do that as a second part. But I'd like to invite anybody for the first part who's lost somebody that's here today. If you want to come up and join this proclamation signing, this is truly more about you than anybody else. So feel free to join us. Thank you all. God bless. Everybody who's doing this work, keep it up. Let's make sure this next year we do even better. Thank you all.